Hello, I'm Dr. Warren, and today I want to go through part of what we look at when a patient has mold in the clinic causing their problem. What may trigger us to think it's mold, and what mold does to your health, and how to go about fixing it. We're going to cover this briefly today. This is a picture we use in the clinic about inflammation. We think inflammation is the key to helping people who have chronic health problems. And I want to highlight here that mold is one of many things that can trigger this inflammation, including Lyme disease and stool problems and foods and chemicals. But mold is a very common one that we deal with. So let's dive in. So mold is usually coming from a house or water damaged building. It's not usually this obvious. Most times it's behind something, or it's behind a shower or a tub or in an attic or in a basement or something. It's usually hard to see. If you can see it, you're one of the lucky ones who it's more straightforward. Which patients have mold? That's a really good question. In our clinic, I really think about it. If you've done a gut program or a hormone program and you have not gotten the results that you expect, mold becomes higher on my list of suspected problems that's screwing you up. If you are sensitive to a variety of medications or supplements or chemicals, we start to think about mold because mold really backs up the liver. And then when your liver is unable to process things properly, you become much more reactive. Also, weight changes that don't necessarily make sense with your diet or with your exercise routine. We think of toxins such as mold causing either weight loss, but more often weight gain. So to reiterate, we have failed programs, reactivity to supplements, reactivity to other chemicals, and lastly, abnormal weight changes that make me really think about mold being a possibility for someone. I want to note that we did some training a few years back with Dr. Richie Shoemaker, and he really exemplifies something called CIRS with mold. It stands for Chronic Inflammatory Response Syndrome. And what he has really spent his career fighting for is that mold creates an inflammatory response in some people that then becomes part of the chronic illness. So it's not just the mold itself, it's an abnormal immune response as part of the problem. That's important to consider. I summarize his work by saying, first you get mold, then you get inflammation, then all hell breaks loose. And it's that abnormal inflammation sometimes that patients feel so much and so many diverse symptoms all over their body. Now, genetically, it's important to remember that only 20% of people are very susceptible to mold. And thus you can have a house that's contaminated with mold and really only have one person in it who's sick. And the other people in the home really are just fine and do not have the same health problems. And that's actually common. One of the questions we get is, wouldn't everyone in the house be sick? The answer is no. Really, genetically, even in families, we usually get this to be only one or two people in the family are sick and the other people are okay. Now, key points that I really want to make here is that mold inflammation can persist even if you come out of the house. So you need to be out of the location to heal. But it's not like a weekend away or a trip away. For most people, it's not long enough to be away to feel really good. So getting out of the moldy environment and then detoxing the body of mold is necessary, but you may also have to go through and kind of reboot the body. You may have to then fix the hormones, then do the exercise program, then do the gut program, etc., in order to heal. But if you try these programs while you're still mold toxic, they won't work. So it's important to just remember it's more than just getting out of the mold that it takes to heal from something like this. Now, how do we test people for mold? Well, we go through history, we ask about symptoms. One of the key things we want to know is, did your health change within about 6 months of a move? And if you get your chronic illness really exacerbated or a rise in your symptoms after a change in location or within a few months of a change of location, then mold becomes, the top of our priority list. The other thing we want to note here is there is some different inflammatory markers that you can run. C-reactive protein does not often pick up mold, so you need to run things like MMP9, TGF-beta, and VEGF. These are more common forms of inflammation that are elevated with mold that C-reactive protein is not typically elevated with mold, and that can trick some of your doctors. The other thing we want to point out is urine mycotox testing is really the way to go here. You can do a urine test and see if you are eliminating out mold toxins. This is not normal or usual compared to healthy control people. And so that is really the most direct test to see if there's literally mold coming out of your body. Now, if you find mold in your body, then the question is, are you currently exposed or is this a past exposure? And so we end up running either ERMI testing or EMA testing is what we've been using more recently in the office, which will test the dust in your home. I don't have time to really go in depth into home testing, but just know there is a whole history between asbestos and mold. The short version is insurance companies paid a lot of money for asbestos. And so when mold came up, they did not want to have the same experience. And really, there's a lot of protection in insurance programs to protect the insurance company from having to pay for mold remediation. And that unfortunately makes this a little bit harder to go about fixing in your home. And just a warning, because of this, you've had a generation of builders and home inspectors really been educated that mold's not a big deal. And this has been something that we've had to fight uphill against, is that some people are very, very sick from water contaminated buildings. Also want to note that their standard of air testing is very trickable. Most of these things are heavy. These mold spores are heavy and won't stay airborne consistently, which means it's fairly easy to get negative testing to come out. Now, the other thing is people will use moisture meters. And also, the issue is just the day that the inspector comes is not like your house will be underwater. In a given year, you may only have moisture problems on certain days and on certain times of the year. And the odds of the inspector coming on a dry day versus a wet day where you have moisture problems, it usually works out to where the odds of him coming on a moist day is actually low. So we find that many times inspections go wrong. And this is why we really like EMA testing. It's more consistent testing the dust, and you can see what kind of mold has been going through, or the mycotoxin, which is the toxin the mold is producing. This is what we want to focus on today, but what we use in order to detox mold, our top two things are really a zeolite, charcoal, and fulvic acid product we call mycobinder. And mycobinder is terrific for helping to bind a variety of different molds. We want to couple this with Saccharomyces boulardii, which is a probiotic yeast that we've been using in gut programs for years and years, but is extremely good at helping with mold-based detoxification programs. Now, these are really our top two and what we find to be the most universally useful for patients who are going through mold detoxification. Now, there's some other options, including chlorella, including beets. Any fiber really will have a certain amount of binding properties, so we can, on some sensitive people, just start doing any kind of fiber, which will help bind and detoxify out some of those mold toxins as they're passing through the gut. The classic medication is called cholestyramine, which we believe is very hard on people unless they have loose stools. You can work with your doctor on that. But for people who don't have loose stools, we find that medication is extremely difficult to tolerate. When we're talking about the mycobinder and the Saccharomyces, what is the dosage? And we want to recommend that this can release and kind of stir up some of the mold and can give you a slight exacerbation of symptoms. So it's important to start slowly. We often start with one capsule twice a day of the mycobinder, and every 3 to 4 days we'll often bump up until you get to 3 to 4 capsules twice a day. If you get exacerbated symptoms, you can proceed slower than that. We have some people who move up every week or every 2 weeks, going as slow as your body needs to so that the detox symptoms don't become overwhelming. Is important for you to pay attention and listen to your body and how you're responding. The Saccharomyces typically will start at 1 a day, and I'll go up to 4 a day in divided. So I'll go 1 twice a day and then 2 twice a day, and we'll move up in similar fashion. You just want to make sure you don't move up too quickly and that it overwhelms your system by flooding too much mold toxin in your system that you can handle. So it's important to do these things one at a time and to take your time increasing the dose so that the symptoms don't become overwhelming as you are detoxing this out of your body. Now, how long are you going to have to do a mold detox? We generally expect it to take about 3 to 6 months to do mold detoxes after someone has removed the mold from their environment. Now, some people do take longer than this, but we would like to do a retest between 3 and 6 months and see if it's clear. Now, if it's not clear, that's okay. You can keep going. And if it's gone up, that can be good because remember, this is an elimination test, so you're seeing your body detoxify the mold. Eventually, the test should come down when your body's done getting rid of the mold. And this can take a various amount of time for different people, depending on who you are. But we think 3 to 6 months is generally a good time frame for you to consider retesting and seeing if the mold is clear. This can obviously be adjusted to your needs. Frequently asked questions. Can I start detoxing while I'm still living in a moldy environment? No, please don't do this. It doesn't usually go well. Okay, question 2. Can you give me anything to help this while I'm living in mold? This is so hard, and I know this sounds mean, but my answer is no. You need to get out of that moldy environment immediately. You're just battling so hard upstream to be going home and breathing in inflammation, feeding problems, then trying to take turmeric to lower the inflammation. It just doesn't work. You have to live on it, and it just doesn't work. So can you start doing gut repair or hormone repair while you are doing mold detoxification? The answer to this is often yes. You can repair the gut, do some other things based on your symptoms. If you want to help adrenals or help hormones, you certainly can be doing that simultaneously while doing detoxification of mold. Conclusion, mold can mimic many other problems, and it can cause gut problems and hormone problems and nerve problems and fatigue problems. So if you're having a problem you're having trouble solving, it may be worthwhile to run mold testing and see if this is a factor that is hindering your health. It is not the only cause of inflammation, but it's something very frequently we find in the clinic that gets missed other places. The urine testing for mold is wonderful. It's something we highly recommend, and we do in the clinic regularly. You cannot get better by detoxifying and still living in the mold. It is very important that you have to live not in a mold-free environment, because there is mold outside, but you have to clean out the harmful mold that's in the building. And then after you clean out the moldy house, you have to detoxify the person. And you may then need to do some kind of rebooting your hormones or your gut or your mitochondria from the damage that's been done. So it's important to just note that this can be a long process to clean the house, then clean the body for 3 to 6 months or more, and then just work on rebooting adrenals or rebooting nerves or rebooting, other things. So be patient with yourself as you go through a mold recovery program. But those products, that Mycobinder and the Saccharomyces sylvardi, are the 2 mold binders we've used extremely well. One more note I want to go is you cannot be constipated when doing any kind of a detoxification protocol, and a mold detoxification protocol is no exception. In our office, we recommend vitamin C and magnesium if you're having troubles with constipation, because you have to have regular bowel movements while going through any detoxification process. That will greatly help reduce any negative symptoms you have if you're having normal bowel movements. I hope you found this helpful. I'm Dr. Warren, talking a little bit about mold today and how you can help heal from it.